Next up, we have, let's see, Jessica Castrodale is here, Nancy Linton is here, and they're going to talk to us about the Cabarrus Health Alliance's 2012 Community Needs Assessment, which you will find starting on page 20 in your agenda. Welcome, ladies. Thanks for coming today.
It's good to be here.
Thank you. We appreciate that introduction. We'll just jump into our information. We have asked to have it on the screen for the benefit of the audience, but we're aware that you all have your slides in front of you.
Before you get started, is there a way that we can also have this put on our website, accessible to the public, so that if they can't find it at the Cabarrus Health Alliance, it certainly would be accessible to the people, and also when it's running on channel 22, we can put a web address.
I'm sure that we can.
We're not in because that's what we want you to do. I guess the folks that are technical need to really answer that question. But
I'm sorry to interrupt, but
that would be our preference if that's possible. We would love for that to happen. Okay. Our 2016 Community County Needs Assessment is the product of the Healthy Cabarrus Project. It is a state-mandated activity that we do. With regard to the Healthy Cabarrus organization, you can see the mission statement there on your slide or on the screen. We're really looking to coordinate efforts to avoid duplication, to share community assessment and problem solving, and we're looking for collaborative strategic planning as we prepare this information and supply it to the community. Our overall goal was to improve the overall quality of life and health status of the Cabarrus County residents through the process of conducting a comprehensive community needs assessment. Our objectives included the identification of emerging needs and issues, reviewing our 2008 priority needs, documenting progress from 2008, and examining community resources. And then, as a final item, to prioritize the needs. If you will look, I won't read this to you, but there are just 4 categories that we've identified progress from the 2008 survey. A couple to make you aware of: there is a new CHA dental clinic for the underserved. There is also a new transit center in Concord under our transportation category. Our request of you and the community members here in the audience, or those who might hear about this later, is to learn about the current situation, how you can become involved. We hope to inspire folks with the information that they would actually participate and play a role in helping to shape our community, and then, of course, helping us to share the word. The types of data that we've looked at, we looked at 5 this year. We added 1 this year, which I'm really very excited about. You can see them listed. We've used the typical CDC-type statistical indicators, birth rates, death rates, and such. We also surveyed almost 1,700 individuals within our community, within Cabarrus County, and received information from them on what they understood unmet needs to be. A little more than 90 community leaders were provided an informant survey that they also responded to. In 2008, for the first time, we included an environmental survey or assessment, and in 2012, we're pleased that we've done a health resource inventory, and this particular document will be of very great value to the community. It will list the things that already exist within our community and resources that people may turn to. 4 of the driving changes that we always have to look at is the increase in population, the increase in poverty rates, housing affordability, and the insufficient economic opportunities. These somewhat overshadow everything. Population, it won't surprise you. In 10 years, we've grown 33%. Next. When we look at our increasing poverty rates, excuse me, it's late in the day. If you'll just notice, and go ahead and get to the next slide, because the darker colored areas on the map reflect the highest percentage of go back one for me, please. The highest percentage of children living underneath the federal poverty line. And now to the next. As we look at the increase in the households receiving food stamps, we have a 380% increase from 2000 to 2010. And if you will appreciate that we do look at a lot of data points that are done on a 10-year basis, if you will, and this is one of those in which we see that 3.3% of Cabarrus residents were receiving food stamps in 2000, and that increased to almost 12% in 2010. You can also see a similar increase for the state of North Carolina.
Can I ask you a question on that?
Yes, ma'am.
Is the increase due to population increase? Is the, percentages sometimes, you have to know the numbers behind them. Do you know if the increase is due to us growing at such a great rate? Is it due to the recession that we've been in? Is it due to different rules in place?
If we were
A
to
combination of the above?
Right, I'm thinking that that's exactly right, a combination of all those factors, because you can see that this is 2010 data, and we know where we were in 2010 economically and with population growth. So I'm not sure where this particular statistic is reported out of, but if we were to go back into the secondary indicators document that you'll find online, we can nitpick that a little bit, and I'll be glad to get back with you with the answer if you're interested.
Well, and the eligibility has been expanded
Yeah.
since 2000.
The eligibility expanded with Governor Perdue
Correct.
3 years ago.
Yeah.
And that's what I asked when we saw this at the Health
Sure.
Alliance is,
Right.
have you had a chance to drill down and see? And they were going
Okay.
to look into it, so they may have already done so.
Okay,
but
good,
I haven't
thanks.
heard that.
Yeah, it'd be interesting to see
It
at the
would.
time when the eligibility was expanded, how that, affected the percentage.
Okay,
Well,
thanks.
if it was 11% in 2010, what is it now? You know?
And quite honestly, we do not have that particular statistical
It's
indicator.
got to be more though, correct?
One would expect, and one would expect that there's a possibility that there's been also some improvement on the other side in the last 12 months or so, possibly. We can ask our cohorts at the Health Alliance to look into that and provide back some feedback.
I'll be glad to do that.
Thank you.
I'm sorry for interrupting, but when I looked at this at home, I wanted to make, I knew that, there's data behind the data.
Right,
And,
absolutely.
this is only good as what's supporting it, which of course you know. So those
Sure.
are the questions that came to me just right off the top. So anyway, sorry, go right ahead.
Okay, thank you. The next item just to discuss is housing affordability. This is a very, very busy slide, and I'm not going to try to read all of it to you, but what we're trying to show, and if you'll just notice, the increase in households with a high rent-to-income ratio. And in this respect, we're really looking at what does it cost to rent, and specifically a two-bedroom apartment or two-bedroom housing, and in relationship to your income, is that an affordable amount? You all, if you're homeowners, you understand that the bank looks at whether or not your disposable income is appropriate or not, and we find in Cabarrus County that 40% of the population is experiencing a ratio that is higher than what we would desire. And if you look at the comparison there at the top of 85%, that is the increase of that number. But 40% of our community members are experiencing a rent-to-income ratio that is higher than we would like. Okay. And just to put that in practical senses, it costs on an average around $800 a month to rent a two-bedroom apartment, and at an hourly rate of $15.50, that is manageable. But with minimum wage at around $7.25, I know that's a little bit increased now, but 44% of Cabarrus County renters cannot afford a two-bedroom rental unit. A little different number, but it's a little different way of saying that. And I would challenge all of you to describe your ability to live in a two-bedroom home. Okay. Insufficient economic opportunities, and this may take us a little bit back to the earlier question. As we notice that the drop in manufacturing, almost 62% change in manufacturing jobs, and an increase in leisure and hospitality, education and health services, some of the roles that have maybe not traditionally been as high paying as manufacturing jobs. Next slide. And again, that was just to emphasize the loss of manufacturing and the gains there that are also in some of those areas that have a little bit more instability.
And I think what you said is exactly right. The manufacturing jobs that we used to have were very good paying and provided a livable wage. And a lot of the hospitality jobs that our society has moved into, because we have lost, not just in Cabarrus County, but in the United States, we've lost so many manufacturing jobs. And what they've been replaced with are ones that are not livable wages.
Right,
And that greatly has impacted this community.
right.
Is more and more reason why, as we all agree, we'd really like to get somebody out there in that Philip Morris property that's manufacturing and be able to pull some other businesses in here that provide manufacturing, because those positions do pay better. And we look for, when we do incentive grants, we look for what the wages are. That's one of the reports that we get. And would hope that we are getting these jobs that are manufacturing that are paying better salaries.
I noticed that we've only had a net increase of about 5,000 jobs from 2000 to 2010. In that same period of time, population was increased by about 45,000 people.
That's a
Now,
great
that's-
point.
You know, you think about that just a minute. If that means that if you figure that 1 out of every 3 of the 45,000 works with full employment, we only have 5,000 jobs, new jobs for those 15,000 people. And that means 10,000 people are either unemployed, underemployed, or working outside the county somewhere.
And we're going to look a little bit more of that
Yeah.
exact point. So when we went to select the 2012 community priorities, we looked at the data and said, how many people are affected by this? We looked at the magnitude of it, the consequences, how severe is the problem, what disability or death or economic or social burdens are caused because of this, and then the feasibility. How easily fixable are these particular issues? So if you'll, next slide. We chose 6 community priorities. These look very similar to how they did in 2008. Wellness and obesity, housing, under and unemployment, education, access to health care, and mental health were the 6 priorities defined this time. So in looking at just a little snapshot of the priorities, each on their own, wellness and obesity, and next slide, 78.5% of Cabarrus County residents report that they don't eat enough fruits and vegetables. And we didn't ask how many fruits and do you eat enough? We said, how many do you eat? And then we figured it up. And if we were to poll one another, how tall are you, how high are you, how heavy are you, and how many fruits and vegetables do you eat, we might make ourselves look a little better than we really are. So this number may be a little higher than what they reported. These are all self-reported data. And back up, please. If we were to look at the childhood overweight and obesity, North Carolina, about 34.2% are overweight or obese, and in Cabarrus County, that number is 41% of children are either overweight or obese. When we look at adults, North Carolina and Cabarrus about the same at 66.5%. Okay? Unemployment and underemployment. We asked consumers, go ahead and pop the next slide too. We asked consumers, are you happy and are you working? So 46% said, yes, I'm happy and I'm employed. That left 54% who were either unemployed and unsatisfied, unemployed and seeking, which is the 18%, unemployed and not seeking, not looking for a job is 6%, and then 9% are disabled. So we said to those who were looking, we said, so what are the reasons you're not working? 38% said there aren't enough jobs out there. 29% said I don't have the experience for the jobs that are out there. 26% said I don't have the skills. 25% said I don't have the information I need. And 21.8% said they're lacking a certification that would qualify them for a job.
Do you know if that was a single question with those answers that a person could say lack of job and lack of experience? Or are they only allowed to answer have one answer for that question?
I would have to go back and look,
Okay.
but having done this in the past, I would expect that this is a compilation of a few questions that teased out these
Okay.
results.
Okay.
Next slide. Access to health care. If you see that box on the top right, 100% of consumers that we asked said that they had foregone at least one health service because of cost. We all in this room probably hate it when we get our medical bills, but we usually pay them. 51% of people said they hadn't gotten their teeth cleaned because they couldn't afford it. 48% said I needed a root canal or a cavity filling, I couldn't afford it. And 41% said I can't afford my prescription medications. 21.9% of people that live in this county are uninsured, and that certainly affects access to health care. Next. Mental health. We asked people in the consumer survey, have you or anyone in your household had difficulty obtaining these services? And you can see that 86% did indeed have difficulty obtaining mental health services or alcohol and drug abuse services, which are mental health services. But isn't that incredible to look at 86% couldn't get help with an alcohol or drug problem, or help for anger and violence issues, or mental health services? And we know that if we can control our alcohol and drug abuse problems, that affects these other things, anger and violence and other needs. So that was really impressive to me. Go ahead.
Oh, okay. Just a couple of questions I'd point out too, because I know that Cardinal Innovations, formerly known as PBH, works strongly with the Medicaid community, but I see this is probably the folks that are above the Medicaid qualification, because I know there's a lot of insurance plans that don't include very robust mental health services.
That is correct.
So a lot of this is out of pocket.
Right.
That those that don't qualify for Medicaid are having to spend, and this is another one of those things I think that is a result of not having enough, being underinsured or not having the resources to be able to spend on mental
If
health
I understand
services.
what you're saying, I believe I do agree
Yeah.
with you. One thing too, though, I believe there's a shortage of mental health providers in this county. So that's something that we need to work on.
And that's just a comment, but though yesterday, our pastor pointed out in a survey that in statewide, not here in Cabarrus, statewide, only 18% of people regularly attend a worship service.
Wow, that's amazing.
Now, you think about it, we're in the middle of the Bible Belt. A lot of these things are stuff that I think in the past were probably a pastor, minister stepped in and provided counseling in some of these
Right.
situations. That's so much more of a population change where people are not connected to a faith community.
Right.
As you see that, could that be a reason why?
I think that's a lovely point that you make, and I think it would be a challenge for our churches to consider how can they use the resources that they have to provide some of these services that are so lacking. Great point.
And our faith community has been a location where we've tried to expand this information this year as well.
And I want to add, Commissioners, I know you already know this, but as the county has an employee assistance program so that our employees, and it's completely anonymous, do have access. They can go and get counseling. I know Cabarrus County Schools also provides that for their employees, and family members have the opportunity to go. I guess my only other comment would be, I know that we've provided that, and I think it's a good service for our employees. I'm kind of curious how much, and it would be other data, you wouldn't be able to answer it tonight. But also, you said that one of the problems we have is a lack of people to provide this service.
Right.
And I'm wondering if there's a lack of available knowledge, that people know that they have a problem, they might know a family member that has a problem, but yet they don't know exactly who to go to, even to, who do I even call? Is
Right.
there, do you know, do we have any kind, maybe through the Health Alliance, some kind of a hotline phone number or something
Yes.
that people?
PBH provides one of those, and that's one of their goals. They have an outreach person to try to increase awareness about their services and connecting people with mental health services.
I think that's just as important, that you just don't even know where to go to.
Right.
And I try to remind people that there are services available, but sometimes it's just a matter of a lack of knowledge of even knowing what's out there too. So,
Right, absolutely.
thank you.
Next slide, please. Education we saw some good news in education in that bottom left box. In 2009, Cabarrus County as a whole had a lower teacher turnover rate than the state did. We looked at the consumer survey and determined the top 3 unmet educational needs were computer training, vocational training, and job-seeking skills training, how to dress for an interview, how to perform well in an interview, how to fill out an application, etc. So if we look in the box in the top right, from 2005 to 2009, the change in student demographics, you can see that there's been a 17% increase in student population during that time compared to 4% for North Carolina, and a 34% increase in the number of eligible students for free or reduced price lunch. So that's an interesting statistic as well, and it may mirror some of the findings when we go back and drill down the data for the food stamp program. Housing. We asked consumers, what are the top 3 reasons household members could not afford to get their own homes? And if you look on the box on the right, it says 15% of people who answered the survey said that they have other adults living in their household because that person can't afford to rent or own. So we said, why is that? Well, 50% said the rental fees are too high, 41% said houses cost too much, and 21% said difficulty getting credit. And we asked key informants what they thought were the 3 most significant housing issues, and they identified homelessness, affordability, and quality. And the box on the lower right just reiterates that there's been an 85% increase in the number of households with high rent-to-income ratios.
Did the surveyor differentiate on the, when you look at the 15% and whether adults live in their home, that those adults are adult children in their 20s that don't seem to want to spread their wings and fly away, or
Right.
is it the taking in a neighbor, having a neighbor or a brother or sister,
Right.
aunt,
My
uncle?
recollection is from having completed the survey that that was one question that did not tease out that data.
Okay.
But we're very much aware of the occasions where 2 families are living in one household, or even the situation where grandchildren and adult children are living in a household with a grandparent.
I was actually one of those who answered yes. I had a family member living with me who had made a bad choice as an 18-year-old and could not get a job, therefore couldn't get a place of his own, and was trying to work his way through college and is now working fast food and living on his own. So. All right, so once again, there's the call to action. I won't repeat that. The next steps, next slide, would be, we're in the process of publicizing and distributing the results. We ask that the people who hear this look at and determine some action plans that they could implement, then implement them and monitor and evaluate the results and just see how well did these interventions work. And then go again. These are the Community Planning Council members, and on the last slide, you'll see where you can get the full reports, all the data, and some contact. Any other questions? You guys have been so good to listen to this long presentation. Appreciate it.
Commissioner Meesmer, do you have
Yeah,
questions?
I
Excuse
do.
me.
Let's see here. Let me flip back through. I had a,
Question while you're looking.
yeah, go over.
One of the things I think we miss as a community is the understanding the importance of dental and the access to dental.
Right.
I've always been surprised and always will be surprised that so many health issues can be identified by going to see a dentist.
Yes.
It doesn't solve all of them, and it doesn't find all of them, but it's almost like a first line of defense is that and so it's so important for the children to go see dentists to get on the right track and at least get an idea about what's going on. So I've been always surprised at that, even after I've heard about it quite a bit.
Yeah. It's my understanding, too, that we have a dearth of dentists in this county, so anything we can do to recruit dentists would be a positive thing.
Okay. The question I had was in regards to, the income, the rent increasing.
Yes.
What percentage of income what percentage of the income should be rent? What is that based upon? It says,
Let me see.
Well, I remember that when I was buying a house, that they did not want more than 35% of your income going to your combined requirements for your
Right,
home,
okay.
your
Well,
living.
that's
And
what
something similar would apply for a renter.
okay, well, I was just wondering if that's what this was based upon, is it that number or what?
The
Taking
the
it-
one slide had 30%.
It's supposed to be
Was it-
30%?
I think there is one slide, and I'm sorry, I don't know exactly
I
which
looked
page it
for
was.
but potentially I missed that.
It was probably in that beginning
Yeah,
section.
I'm gonna flip and see.
I'm gonna write that down as something to look up for you
Okay,
and get back
thank
with you. So you're wanting to know, what is the rent to
You'll
income
look on
ratio?
page
Right, that-
33.
Okay,
It says reports renter occupied housing units with households paying greater than 30% of income to housing.
okay.
Okay.
Yeah, it's on 13, is page 13 as well.
Okay, it's on our agenda book, it's page 33 that talks about affordable
I
housing.
see that.
Because that particular figure does not include utilities, as I think sometimes your banker would want your home
Did
mortgage.
y'all get an estimate of how many people in this county is working at minimum wage?
I don't know if we did or not, but.
And that would be the type of statistical data that would just be hard data from, that we probably do have access, but in terms of our community report, I don't recall us discussing
Ryan,
that
do you know?
specifically.
Okay.
What is minimum wage now? Is it $7.25?
Mm-hmm.
Well, that's for 2010. I figured it'd be going up since then.
They're working.
I mean, it'd be hard to live on $15 and pay 35% on the house or rent, especially if you're paying for somebody else's house, renting it. I know you can't make it on $7.25, no way.
Yeah, and one of the goals that people often have is to live on their own and have that little place with the white picket fence and raise a family. That's a goal we typically all have until we get too discouraged to dream of that anymore. So,
But it isn't necessarily a bad thing to have people within a family structure and household longer than what might be 18 years and on your own. Sometimes that helps them to develop the stability and the resources to be successful once they're on their own.
Any other comments? I think this is a very important document, and I'm glad that the Health Alliance and Healthy Cabarrus does this. It's every 4 years? Is that
every
right?
4.
Every 4 years. I mean, I think it's important, not only for us to have the information, because, you know, we need to be aware of what's going on in our community, but more importantly, how we can take this information and, for us as an elected body, make decisions, and the other bodies. I know that you have been presenting, I believe, to all the different municipalities also.
Yes.
If there's anybody else in the community that would like to have a presentation, any businesses?
Barbara,
contact
Victoria,
you?
and Tracy are the point of contact. They will make sure someone provides that information to the group that's identified.
So if the Chamber of Commerce wanted to have a presentation?
Well, they've
Y'all have
actually
already done
done
that,
theirs.
right?
They've already had theirs.
I thought you
They've-
had, but I just
yeah.
saw it.
And I will say, we spend about 12 months compiling this, so it is a pretty thorough deep dive.
You got a cost on what it costs to compile it?
Ms. Shepherd will, at the Health Alliance. I do not. I do not.
And because even though I introduced you, would you share with our audience that will watch this on TV what your full-time job positions are, just so they know
Yes,
where
I'm
you're-
Jessica Castrodale. I work at CMC Northeast in community outreach.
And I'm Nancy Litton with the American Red Cross, and I work in all kinds of things.
Yes, you are. And Commissioner White, of course, as we know, is our liaison to the Health Alliance Board and sits on their board, so he's very familiar with the activities. So.
And he even gave us the positive feedback of looking interested. I appreciate that. I know you've seen this before.
But it's fascinating, it really is, and I think it's very important for the community to understand. It's a question of what do we want to look at, what do we want to look like, and there's a lot of need out there, and there's a lot of ways to step out there and help. So thank you.
And there's a real good opportunity to document our successes. And sometimes when it looks bad, you forget about the things you've done really well, and to be able to take pride in those.
Well, one of the things too, we'll make another comment, is that, more and more I see it because of the years I spent traveling, working around the Carolinas, seeing small towns, small communities, is that I think the greatest root cause of what we see happening overall in our society with this, as those other things, is the fact that we have seen the manufacturing economy disappear.
Yes.
Just about every small town had in its center, or near its center, a manufacturing plant that provided tax revenue, provided jobs, livelihood for communities. And when those things disappeared, every small community then had nothing to depend on as far as revenue to take care of the people, and more and more of it then poured back up the chain, so to speak, to get more to address the issues. And I think until we you know, we, as a nation, have got to firmly establish or reestablish our manufacturing economy. If we don't, or, you know, or a new manufacturing economy, whatever, but get manufacturing back, we're just on a downward spiral. I hate to be pessimistic about it, but I think that's the biggest challenge we're going to face over the next 10 or 12 years in this country.
Maybe tomorrow we'll have an indication of which way we're going to go
Yeah,
with that.
that's right. So,
Okay, let's do one more thing, and then then let's take a quick break. Thank you,
Thank
ladies.
you
We
very
appreciate
much.
you
Thank you.
coming and being very patient.